Common cardiovascular condition, canine heartworm disease. Heartworm disease is a potentially fatal but curable disease that is caused by a parasite. It's transmitted by mosquitoes, which bites the dog in the dermis layer of the skin, penetrating the epidermis, and the insect carries the larva of the heartworm, so it transfers the larva from an infected animal host to a new animal host. And dogs are a natural host of this parasite, so that means that the heartworms live inside the dog and go through an entire life cycle from mating to larva back to adulthood. These parasites are bloodborne, and the larva will live in the small vessels of the bloodstream. So as you can see with this diagram, we have where the mosquito bites the infected dog, the larvae develop into the infected parasites inside the mosquito, the infected mosquito bites the other dog, and then in 6 to 7 months, the infected larvae develop into adult heartworms inside the newly affected dog. In the early stages of heartworm disease, the body of the dogs will attempt to compensate for the infection by trying to fight it off. So the immune system will attempt to fight off the worms, but the worms are actually too large for the body to eradicate them. And this disorder can lead to chronic inflammation. So the damage that's done cannot be reversed, which leads to the dogs to have an impacted quality of life, even after the heartworms are gone. Symptoms of heartworm may include a persistent cough, decreased appetite, weight loss, reluctance to exercise, or extreme fatigue after moderate physical activity. And as the disease progresses, fluid can accumulate in the body, which is edema, and there is an increased risk of heart failure. So if you suspect your dog has heartworm, your vet can perform an antigen detection test. Diagnosis of heartworm disease can be done during a routine annual veterinary checkup, as long as you do a blood work test, or CBC. A subcutaneous blood draw is performed to test the blood. Pictured here. Annual testing is necessary for the dogs because it takes several months for the larva to mature into the adult, so you have to catch it early. In order to do that, you have to stay vigilant with your yearly appointments and your blood work, so your CBC, your blood chemistries, and your electrolytes. A microfilariae test can be done, which tests for the baby heartworms in the blood, and that indicates the presence of adult heartworms. Other tests you could perform are radiographs, an electrocardiogram, or an echocardiogram. So heartworm disease will take a major toll on the entire body of the dog, and the severity of the disease will depend on the number of worms that are living inside the dog. So these larvae will start out in the bloodstream where they move through the blood vessels, and as they mature, they can put a strain on those vessels, especially the ones leading to and from the heart and the lungs, so your pulmonary arteries. That can cause chronic inflammation. So the changes that happen are irreversible and can cause pulmonary hypertension, and vasoconstriction can play a role in the severity of the hypertension. The worms will also put a significant strain on heart valves, which worsens the workload of the heart, and that can lead to heart failure. Because of this, the kidneys and liver can also be affected through the damage done to the blood vessels. Understanding heartworm disease and the potential health risks that can come from this is important for dog owners because this disease is preventable as long as a dog owner maintains their annual blood work tests, begins their heartworm preventatives, and don't miss a monthly dosage of the preventative medication. This disease is preventable, curable, and it does not have to negatively impact your dog's quality of life as long as you catch it early enough. Routine vet care is crucial to maintaining the health of your dog.